to discuss about the arteries of the head and neck region. So important topic. So we must have to know what are the arteries which are supplying the head and the neck region. So first thing, please remember that arteries of the head and neck region, we will start from the arch of the aorta. So as you can see in this diagram, so this is the ascending aorta, then it's forming here the arch of aorta, and from the arch of aorta, first branch which is coming out, that is the brachiocephalic trunk. Second, that is which is coming out, that is your left common carotid artery, and third one which is coming out, that is your left subclavian artery. So first MCQ which you must have to remember, that the left subclavian artery, it is coming out directly from the arch of aorta. Right subclavian artery, it is coming out from the brachiocephalic trunk. So the brachiocephalic artery or brachiocephalic trunk, it is divided into the right subclavian artery and into your right common carotid artery. This right common carotid artery is going upward, and now it is dividing into these two arteries, that is the external carotid artery and the internal carotid artery. Okay, so first thing what we must have to know about the subclavian artery. So please remember subclavian artery, as this is the diagram which can easily you can understand that the subclavian artery, it is divided into three parts. So it is dividing into three parts. It is dividing into three parts by a muscle known as anterior scalenus muscle. So subclavian artery dividing into three parts by the anterior scalene muscle. Okay, so it is dividing into the first part. It is giving here three branches, V, I, T. So mnemonic is VIT. So first part, it is giving three branches, that is VIT. V is the vertebral artery, I is the internal thoracic artery, and T is your thyrocervical trunk. Okay, so first part is giving you three arteries, the vertebral artery, the thyrocervical trunk, and the internal thoracic artery. Second part, it is giving you the costocervical trunk. So second part, it is giving you the costocervical trunk. And third part is giving, this is the third part. So third part is giving you the dorsal scapular artery. So third part, it is giving you dorsal scapular artery. So please remember the mnemonic for the arteries which are coming out from the subclavian artery. The mnemonic is white CD. So vitamin CD. Okay, so this is the mnemonic to remember the arteries in relation to the subclavian artery. Okay, now after the subclavian artery, see here, when the subclavian artery, it is passing through the first rib, it is now going to continue as the axillary artery. Okay, so it will now continue as the axillary artery. So these are the branches of your subclavian artery. Now coming into the external carotid artery. Please remember internal carotid artery. Internal carotid artery, it is giving directly blood supply to your brain. Okay, so it is not giving any major branches in the neck region. The external carotid artery, please remember, it is giving the branches in the head and neck region. So what are the branches which are giving in the head and neck region? So see in this diagram. So this is our common carotid artery. So this common carotid artery, it is dividing into the external and internal carotid arteries. So see here, this is your common carotid artery. Now it is dividing into this part, This is our internal carotid artery. And this artery, which I am now highlighting in green color, this is our external carotid artery. Now this external carotid artery, it is dividing into the branches. So what are the branches of the external carotid artery? See here. This is the first branch. This is the first branch which is coming out from the external carotid artery. So this is your superior thyroid artery. One. Okay. Second branch which is coming out from here. This is the second branch, that is the lingual artery. Third branch, this one here. This is the facial artery. So these three arteries are coming out anteriorly from the carotid artery. Now two arteries are coming out posteriorly from the carotid artery. See here all students. This artery. This is our occipital artery. One. Then this artery. This is our posterior auricular artery. So this is your posterior auricular artery. So these two arteries are coming out posteriorly. So two arteries posteriorly, three arteries anteriorly. Now there are two terminal arteries. Two terminal arteries. So what are the two terminal arteries? Number one is this one. This is the maxillary artery, and this one which is going upward, and now it is giving blood supply to the scalp region and to the temporal region. That is your superficial temporal artery. Okay, and one more artery which is coming out medially. This one. This is your ascending pharyngeal artery. Okay, so if I write here all the arteries, see here, external carotid artery branches in the head and neck region. So number one, please remember there are anterior branches. So what are the anterior branches? Superior thyroid artery, lingual artery, and third one is your which one? Facial artery. Okay, so these three are the anterior branches. Then we have posterior branches. What are the posterior branches? Occipital artery and posterior auricular artery. Posterior auricular artery. Okay, so these are the two posterior branches. Then there is one medial branch. What is the medial branch? Ascending pharyngeal artery. Ascending pharyngeal artery. And then we have two terminal branches. So what are the two terminal branches? Number one is the maxillary artery, and number two, it is your which artery? Superficial temporal artery. Okay, so this is your branches of the external carotid. It is also giving blood supply to your tonsil also. Okay, so tonsil blood supply is also from the maxillary artery. It is also from the facial artery. It is also from the ascending pharyngeal artery, and it is also from the lingual artery. So all these arteries, see here, 1, 2, 3, 4, all they are giving branches and giving blood supply to the tonsils also. But main blood supply to the tonsil, it is through the facial artery. So all these are the branches of your which artery? All are the branches of your external carotid artery. So see here, this is your external carotid artery going upward. Now these two are your terminal branches. So this is your superficial temporal artery. And this one here, this is your maxillary artery. Okay, this is your maxillary artery. Now see here, this is the medial branch. What is the name of the medial branch? Ascending pharyngeal artery. Now it is giving here the tonsillar branches of the ascending pharyngeal artery to the tonsils. Maxillary artery is giving here the branch that is the descending palatine artery, which is also giving blood supply to the tonsils also and to the palate also. Okay. Facial artery, see here, this is your facial artery. It is giving here direct branches, tonsillar artery to the tonsil, and one more artery which is a branch of the facial artery, that is the ascending palatine artery. So please remember one MCQ here, that facial artery is giving here the ascending palatine artery. This is your MCQ. And the maxillary artery, it is giving you the descending palatine artery. Okay. And then here this is the lingual artery, which is also giving here the branches, the dorsal lingual branches, which is giving blood supply to the tonsil. So this is your whole blood supply to the tonsil also. So if we draw here one diagram, see here, this is the arch of aorta. Through the arch of aorta, see here, three branches are coming out. Okay. So this is your what? Brachiocephalic trunk. This is your left common carotid artery. This is your left subclavian artery. Okay, left subclavian artery. You already know left subclavian artery, it is coming out directly from where? Arch of aorta. Right subclavian artery, it is coming out from the brachiocephalic trunk. So this is your what? Right subclavian artery, and this will be your right common carotid artery, like this. Okay, so this subclavian artery, it is dividing into three portions. By which muscle? Scalenus anterior muscle. Okay, and from here you have three branches, 1, 2, 3. Here you have one branch, here you have one branch. Which branch? C and D. Vertebral artery, internal thoracic artery, and your which one? Thyrocervical trunk. C is your costocervical trunk, and D is your dorsal scapular artery. Okay. Now see here, all students. This, for example, I take this carotid artery. Now it is dividing into two branches. This is your internal carotid artery, and this is your external carotid artery. Now this external carotid artery, it is dividing into these two terminal branches. What are these two terminal branches? Superficial temporal artery, number 1. Okay, and second is which one? That is your maxillary artery. Okay, so maxillary artery and superficial temporal artery, they are your what? They are your two terminal branches of your external carotid artery. So what are the first branch? First branch is your superior thyroid artery. Second branch is your lingual artery. Third branch is your which one? Facial artery. Facial artery. Okay. Here you have one medial branch, that is your ascending pharyngeal artery. Then you have here two posterior branches. What are the posterior branches? Occipital artery. And this one is your which one? This is your posterior auricular artery. Okay, posterior auricular artery. Please remember, superior thyroid artery is giving blood supply to the thyroid gland, and from the T branch, from your thyrocervical trunk, there is also inferior thyroid artery. Okay, so thyrocervical trunk, it is giving here the inferior thyroid artery, which is also giving blood supply to the thyroid gland. Okay, here I can write here the tonsils also. For example, if this is the tonsil, so from the maxillary artery, for example, this is the maxillary artery, one branch is going here and giving blood supply to the tonsil, So this is your which artery? Descending palatine artery. Okay, so this is your descending palatine artery. Okay, now see here, this ascending pharyngeal artery, this one, it is also giving blood supply to the tonsils. Okay, then this facial artery, for example, this is our facial artery. This is giving here direct tonsillar artery to the you can say to the tonsils, and this is also giving here one branch to the tonsil, that is your ascending palatine artery. This is ascending palatine artery, and this is your ascending pharyngeal artery. This is your ascending pharyngeal artery. Okay, and this is this APA, this is your ascending palatine artery. Okay, ascending palatine artery. This lingual artery, it is also giving here branches to the tonsils. So this is your which artery? This is your dorsal lingual artery. Okay, this is your dorsal lingual artery. So this is the blood supply to the tonsil. I hope it is clear to all of you. Okay, now coming into the maxillary artery. Now see here, maxillary artery, it is one of the terminal branches of the your which external carotid artery. It is dividing into three parts: the mandibular part, the pterygoid part, and the pterygopalatine part. Okay, so this is our terminal branch, and this second will be your which one? Superficial temporal artery. Okay, so from the first part, this artery is going down here, giving blood supply to the lower T, that is the inferior alveolar artery. Second part, you have buccal arteries and some arteries which is giving blood supply to the muscles also. Very important blood is your this branch. This is your middle meningeal artery. Very, very important. I tell you why it is very, very important. Coming out from the first part of your maxillary artery. Okay, and this third part, it is giving you posterior superior alveolar artery. This third part will be going, it is continuing as your inferior alveolar artery also. Okay, so it will be continuing, sorry, it's not as the inferior alveolar artery, it will be continuing as your inferior or infraorbital artery. Okay, infraorbital artery. Okay, so this is your infraorbital artery. So it is continuing as an infraorbital artery, and then it is giving here these branches, that is the posterior superior alveolar artery. There can be anterior superior alveolar artery, like that. Okay, but this branch is very, very important, that is your middle meningeal artery, which is coming out from the first part of your what? It is coming out from the first part of your maxillary artery. So if we draw here the maxillary artery, for example, see here. So this is our external carotid artery. External carotid artery is going upward and giving here the branch. So this is our maxillary artery. Okay, now this maxillary artery, it is dividing into three parts. First part, second part, and third part. So this is the first part, this is the second part, and this is the third part. So from the first part, you have this artery coming out here, that is the middle meningeal artery. This middle meningeal artery, please remember, it is passing into the skull through foramen spinosum. Sometimes there is an accessory middle meningeal artery also. Okay, accessory middle meningeal artery also, which is passing through foramen ovale. Then there is one more branch coming out from the first part here. This one. So this is your inferior alveolar artery. See which artery? Inferior alveolar artery. Second part, some muscular branches. Third part is important. It will continue as your infraorbital artery. Continue as the infraorbital artery. It is giving here the branches anterior superior alveolar artery or posterior superior alveolar artery also. Okay, so inferior alveolar artery to the lower teeth and the superior alveolar artery to the upper teeth. Okay, it is also giving here the branch. This is your sphenopalatine artery, very important. Sphenopalatine artery. Okay, and this is here, it is giving here the branch. Which branch? Descending palatine artery. This descending palatine artery, it is also giving here one more branch, that is your greater palatine artery. Okay, which artery? Greater palatine artery. Why these arteries are important, I tell you. But first we must have to discuss the middle meningeal artery. This greater palatine artery, please remember, and sphenopalatine artery, it is also contributing into the Kiesselbach plexus also, which is the little area present in the nose which can lead to bleeding from the nose, known as epistaxis. Okay, now first we must have to discuss the middle meningeal artery. Please remember, middle meningeal artery rupture or bleeding leads to the epidural hematoma in the patient. Okay, it can lead to what? Epidural hematoma in the patient. And please remember, this artery is passing through this point here. This point is known as pterygium point. Please remember, pterygium point, what is passing? Your middle meningeal artery is passing, which is a branch of your third part of your maxillary artery. Which is a branch of your what? Third part of your maxillary artery. So when it bleeds, patient will develop epidural hematoma. Please remember, epidural hematoma, you are going to perform non-contrast CT scan in the patient. Non-contrast CT scan. And on the CT scan, you are going to find this hyperdense lesion. Hyperdense lesion. Now see the shape of the hyperdense lesion. It is biconvex or lens shaped. So patient comes to you with what? Patient comes to you with history of road traffic accident, and what you are going to perform in any head traumas, investigation of choice is non-contrast CT scan. So non-contrast CT scan, if you find this biconvex lens-shaped hyperdense lesion, it means this is a patient of your what? This is a patient of your epidural hematoma. So what is epidural hematoma? Collection of blood between the skull and dura mater. Between the skull and what? Dura mater. Please remember, patient will have lucid interval. Okay. Patient will have hyperdense biconvex lesion, lens shaped. This lesion is not going to cross the suture lines. Not going to cross the suture line. And what is the management? Management is burr hole or craniotomy. Burr hole or what? Craniotomy. Okay, so this is your middle meningeal artery. Please remember, epidural hematoma, Bleeding blood vessel, most common is the middle meningeal artery, which is a branch of your maxillary artery, which is passing here to a point known as pterygoin. This is also your MCQ. Okay, so this is your middle meningeal artery. Now see here. Now this is the Kiesselbach's area, which is a cause of epistaxis in the patient. Please remember these four arteries. Number 1, ethmoidal arteries. Number 2, sphenopalatine artery. Number 3, greater palatine artery. And number 4 is the labial artery. So, Kiesselbach plexus. Please remember the mnemonic is legs. L is your labial artery. E is your ethmoidal artery, anterior and posterior. G is your greater palatine artery. And S is your sphenopalatine artery. Now see here all students, all these arteries, see here. Labial artery, branch of external carotid artery. Greater palatine artery, branch of external carotid artery. Maxillary artery. Sphenopalatine artery, branch from coming out from maxillary artery. Sphenopalatine. Only the anterior ethmoidal artery. Please remember, very important point. Especially the anterior ethmoidal artery. It is not coming out from the external, all our other are coming out from the external carotid artery except the anterior ethmoidal artery. It is coming out from the ophthalmic artery, which is a branch of your internal carotid artery. So in this Kiesselbach plexus or Little's area, which is a cause of bleeding or epistaxis in the patient, it is formed by these four arteries. All are coming out from the maxillary artery or the external carotid artery, except one artery, that is the anterior ethmoidal artery, which is coming out from the internal carotid artery. So see here, maxillary artery, see here, greater palatine artery,